Hello everyone, let's try to solve this question together. So a newborn is noted to have a swelling on the head marked by the red line. A skull x-ray is obtained. Which of the following would be the most worrisome findings? Pause the slide, take a look. So basically what we see here, we definitely see a fracture here, and we see, this swelling here. So what do you guys think is the correct choice? The correct choice here is subgaleal hemorrhage. Subgaleal hemorrhage, the problem with subgaleal hemorrhage is that, the blood, can just seep out and just goes into the biggest space and can, almost accumulate about 100 to 200 ml, and this could be a shocky picture on the baby. Cephalohematoma is usually, not that big, and because it's under the periosteum, so it never crosses the suture, and it doesn't have the amount of blood is not that large. Linear fracture, as we note here, is worrisome, but it usually is the depressed fracture that is the problem. And open sagittal suture is a normal sign, so you don't have to worry about. So this is basically, I want you guys to remember the mnemonic scalp. So this is the way, skin, connective tissue, epinuresis, loose aerial tissue, and pericranium. So as you can see that this emissary vein, this get ruptured and cause bleeding in this loose area, and which of course can go around the neck and all, and it can really be detrimental to the baby. If you guys have time, just read this article. This is a very nice article which describes the delivery room emergencies from intracranial bleed, extracranial bleed, fractures, and other stuff. These two references are again very important, and they talk about different fractures in neonates. So if you guys have time, do read about it. So in summary, whenever you see a baby with the head swelling, three swellings are important. It could be just caput succedaneum, which is really just tissue of the outside of the skull, which is really under like the subcutaneous edema, which resolves within 24 hours. The other one is cephalohematoma, which I told you is just a subperiosteal bleed. You just have to watch for it. It takes a longer period of time to resolve, but you have to worry about the jaundice, because this contains blood there. The worrisome would be subgaleal bleed, because subgaleal bleed, like I mentioned earlier, is dangerous to the baby. It can cause coagulopathy, it can cause anemia, and even shock. So one has to be very careful about subgaleal bleed. Regarding fractures, like I said, depressed fracture are really, you have to watch, get a neurosurgical consult, or obtain some neuroimaging. But simple linear fracture, you don't have to worry about, as long as the neurological exam on the baby is normal. So I hope you guys have learned something together today. Please do comment on this question, and you guys have a wonderful day. Bye.